Hi, so my name's Prashant. This is Kevin. He's been a patient of mine for about 2 years now, and when he first came in, he had a few missing teeth. He had some problems in the front, and from a technical perspective, his bite essentially was shot. The dynamics was going to lead to more loss of teeth. The fracture of the front tooth is quite symptomatic of when the bite shot, and then everything's going to accelerate and break down quite quickly. So he was quite typical of some of my patients, or a lot of my patients that come in with similar problems. I generally specialize in that sort of building bite rehabilitation work, and to me the solution was quite straightforward. But we did talk about 3 options. We did talk about alternatives that would, may suit him. Luckily, he was, quite receptive of the information we provided, and chose, in my opinion, the right option. Sure enough, it took a long time, but if it was my mouth or my parents' mouth, that's exactly what I would do. I wouldn't talk about it, I'd just do it, but that's what happened with him. We had to build up the lost bone, so there was a bit of wait time due to the grafting procedure, and waiting for that to consolidate. And thankfully, he's been quite a patient. A lot of patients would find it difficult to have missing teeth for such a long time. We do have other solutions for them, where it's more like a teeth in a day solution, but he was thankfully different, and he accepted the most appropriate solution I had to offer. We waited, got the grafting done, and then we did what's necessary with the implant placement, used CAD/CAM generated guides to precisely put the implants in. That's all part of the planning process. Careful planning, that's the key to the success. And he was then very accepting of changes that would have improved the solution. And you only find out about those changes as you go through the journey. So, we've had some in-depth discussions and, collaboration in getting the right outcome. And that's basically what I would say it is. It has been a collaboration to get to the end where I'm very comfortable and very confident that this is the best outcome I can provide him. And it will hopefully last him a long, long time without causing any problems.
And the technicians can come down and look at my teeth while I'm here.
Yeah.
It's a big advantage.
Big difference, yeah. And correct every micrometer of issue that I demand, which is
High.
it's all part of it. Yeah.